Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Welcome everyone to another episode of Reinventing the White Coat. Today I have with me Dr. Charity Hicks, who is an ophthalmologist and a physician burnout and wellness coach for introverts in healthcare. So Charity, welcome and thank you so much for joining me.
Thanks for having me, Jennifer. I'm excited to be here.
Yeah, so I was fascinated when I found out that you work specifically with introverts. And I really, because personally, I didn't even realize I was an introvert till I was an adult. So I thought we could start by talking about how you define an introvert and what's going on with them.
Yeah. And you make a good point. It's funny because the more people I talk to, the more people are like, oh, I wonder if I'm an introvert. So, some of that's just about awareness. And the other thing to remember is when we talk about introvert and extrovert, it's a spectrum. Very few people are just going to be way over here or way over here. So the biggest thing that I always talk about when it comes to being an introvert, it's just about how you re-energize and how you maintain your energy levels. With introverts, they tend to seek more solitude or maybe connection with just one or two people at a time. That's, like a more of a deep connection versus extroverts are, ready to go. They're ready to go out and socialize, be with people. They, tend to enjoy being in groups, and might find some of the things that introverts enjoy rather boring. That's kind of where the biggest thing that I look at. There's lots of other generalities and things that introverts might have in common, but that's the biggest thing is just looking like when I'm feeling wiped out, how do I re-energize? How do I make myself feel better?
And it's interesting because I think that so many people don't really pay attention to that inner energy level, right? What do I need for me? How am I feeling? How do I recharge? And, you can enjoy being with people. Like, so for me, I love going to a gathering and chatting with people, but the end, I'm so wiped out. It's just like, it's draining, right? And then you do need that quiet time. One of my closest friends, she's an introvert and her husband's an extrovert. And I see that it creates a little bit of tension because at the end of a busy day, right? He wants to go out and do all this. And she's like, I need to relax.
Yeah, exactly. And you made an excellent point that there's a lot of times the stigma that introverts are perhaps shy or that they don't like people. And that's not true. It's just that we run into that point where we need a little alone time sooner than extroverts do.
Yeah. So I wanted to bring that up as well. How does this compare to being shy? Because you can be a shy introvert or a shy extrovert, right?
Exactly. Yes. So the way I think about it and the way I've seen it described is think about kind of what fear reactions there are and the avoidance and what you're attracted to. So if you think about a shy extrovert, they want to be around people, but perhaps they're fearful of being judged or they feel, anxiety about what people might think about them. Whereas an introvert, from the outside, it might look the same, but on the inside, it's not that there's this fear of judgment or that they're afraid to kind of be around people. It's more that they're attracted to being in quieter spaces and having solitude. So that's how I tend to think of it, is more of a push and pull type thing. Whereas the shyness is kind of like and the introvert is more like, no, I'm attracted to this, like this appeals to me.
Yeah, this is actually, I know your training is in ophthalmology, but for me, I'm in pediatrics, and this actually comes up for me a lot in talking to parents. And there's this negative connotation and sort of this expectation that kids should always be with friends and out, and I mean within reason. You don't want them out doing dangerous things, but it's that fear. You bring your kid to the party, and parents worry there's something wrong with my kid because they don't want to join the group. And I always try to get to them like, you have to understand where it's coming from. Like you said, it looks the same on the outside, but some kids actually would rather a one-on-one play date than be on the soccer team. And are they avoiding because they're anxious and they're shy and they really want to play soccer? Or do they actually really want to play tennis or something that's more individual?
Right. Yeah. And you were talking about with kids and parents being worried about things. It's interesting because actually some of the more recent studies or some of the more recent statistics suggest that almost half of the population is introverted. And so, a lot of people think like, ooh, they're the minority, but it's more that our society just kind of looks toward extrovert traits as the thing to be or the positive. And like you said, they worry or think there's something wrong
Mhm.
with the introverted traits. And so I think there are a lot of introverts out there trying to act like extroverts, and that's
Right.
not really their nature. And I think that's just part of how in the US our society
Yes.
is. If you compare that to some other societies that are a little more quiet and reserved on the whole, their introverted numbers are actually lower than what we see in the US. But it's just that their society doesn't have that expectation of people like being out there all the time.
Yeah, is that negative connotation is definitely an American thing. I actually try to reframe it also for the families and point out the evolutionary benefits of being sort of cautious and reserved and especially shy as opposed to introvert, that sort of shy negativity. Those are the kids or the people who would jump and just go were the ones who would get eaten by the saber-toothed tiger, so to speak, right? Is the ones who would sort of survey and take slow to warm up, were the ones who kept the tribe safe.
Right. Yeah, definitely introverts are thinkers. We spend a lot of time in our head, we're analyzing all the time. And there's actually been a study, and I don't have the specific, I can't quote you the specific study, but they did MRIs on introverts versus extroverts and noted that introverts actually have extra gray matter in their prefrontal cortex. So there's actually physiologic evidence for suggesting that introverts are just spending more time thinking.
Yeah, that makes sense, right? The extroverts are the doers and the introverts are the thinkers, if you want to. All right, so Charity, I'm guessing you're an introvert.
I am
Okay.
definitely.
So tell me how being an introvert impacts doctoring, so to speak.
Yeah, so I was reading an article one time. I think it was about like what professions are good for introverts versus extroverts. And they listed physician. And I was sitting there, I had already been a physician, and some of my experiences, I was like, what are they talking about? But the introverts, I think, are very well suited to be physicians because they tend to be listeners. And like we talked about, they're deep thinkers, they're problem solvers. They tend to have a lot of empathy, and so, when you're relating to patients, like you said, you're talking to your little patients, and maybe they're shy or they're not shy, and everybody thinks that they're trying to make them do something. So there's that empathy factor. You know, Introverts often are tending to try to do the right thing, you know. And so I think all of those things make for a good doctor. Those are all kind of traits that we would want to see in our physicians or the people that care for us. And I've come to feel that a lot of maybe challenges for introverts in terms of being physicians is more just in how the medical system is set
Mhm.
up.
That's what
Because
I was
like you
just
mentioned,
thinking. Yes. Or the
yeah,
specialty that they choose, right? Like imagine not ER, but something more, psychiatry,
right. Yeah, and often people will quote that like, well, we'll just go into a specialty where you don't have to interact with patients. And I don't even think that's necessarily the answer because again, it's not that we don't like people. We like to take our time with people. We like to get
Right.
to know them, and the whole 7-minute visit isn't really our style. And
Mhm.
there's a lot of noise. Introverts often are more sensitive to their environments as well. So like when there's a lot of noise and activity, that can be detracting. And so it's just some of I think the way that the medical system is set up. If
I
you can
didn't
find,
realize that the sensory issues relating to introverts and I'm thinking about the introverts in my life, the strong introverts in my life who really have that quality linked. Interesting.
yeah, yeah. So yeah, so it's, for physicians that are introverts, I just think about finding ways within the environment that you're in to nurture your introvert self. So if finding little moments of quiet time, or if you've got a busy schedule one day, can you adjust it so that the next day is a little less busy? Or like you mentioned earlier, that with the introvert extrovert couple, like maybe you don't have a lot of activities at the end of planned for the end of the day if you know that your work day is going to be busy.
Mhm.
Um, and I don't know if you've appreciated this, but introverts tend to be, more comfortable with written communication. And so if you're thinking about like meetings and just how you're interacting with, your colleagues and things, having that time to be able to sit down and think through what you want to do and organize your thoughts and be able to
Yes.
put it in writing. I remember reading one time when someone they thought it was they felt that if, phone calls were always more appropriate and emails, um, were kind of intrusive. And I was thinking, well, that's the opposite for me. Like, I'd much rather have someone send me an email. I can look at it, I can process it, I can think about what I want to say and send it back versus just having to pick up the phone and be like, okay. And,
Huh.
so there's just little things like that
I
where
never
you
thought
can
about that
start paying
either, right?
attention to those
So
things.
communication is probably one of um, the challenging things to do well at least in my job, in my company. And we always talk about different modes that meet for different people, but tying it to your introvert versus extrovert never even occurred to me. Huh. I definitely like that thinking about an email and a response. I don't mind getting on the phone and talking to somebody as well, but I do need time to process. When we do our partner meetings, sometimes they're like at the end of a long day, and I always say, I'm like, I cannot make a decision right now. I can't.
Right. And that could be, and I don't know if you've ever heard the term the introvert hangover.
No,
So yeah, so that happens once if you've had a full busy day at clinic and you've been kind of in social mode all day long,
right.
introverts just go into this thing where their brains get foggy. They have difficulty making decisions. They just kind of shut down, like they start zoning out because it's just how their brain's like, no, I
Yeah.
need a break. And
Now I
some
know
people
that
will even
happens to everybody, right? You
right.
get the cognitive fatigue and all of your decisions, your good decisions are best at the beginning of the day. But I suppose there's an inherent difference in some people, a stronger resilience in an extrovert to carry on for longer.
Yeah.
Huh. Um, so tell me about for you specifically in ophthalmology, how this played out and how your path, the path that you took as being a doctor.
Yeah, I mean, I love thinking about things, obviously. I like doing things with my hands, and so that's why ophthalmology appealed to me. And when I chose that as a specialty, I didn't realize that it was also a very high volume specialty typically. And so I found that, that was always a challenge for me, was I would want to sit and talk to people and get to know them, and I'd feel guilty because I felt like I was always rushing. And so that was one of the things that would have been helpful for me to think about, like, ahead of time. And again, that, I don't think it's a specific specialty per se. Um,
The system, it's that fee for
well,
service system, right? The volume.
it's even the practice style that you get into. I mean, I know there are physicians out there working in different models, and so I certainly wouldn't want to say this specialty is off limits and this specialty is the best
Right.
for you. But it's just I think it's just the awareness and knowing what you need, and and then being able to go out and find that situation for yourself.
Yeah.
Yeah.
Yeah. And for ophthalmology, I imagine the days in the OR couldn't possibly be speedy, right? Were those days easier for you to handle than the days in the office?
I mean, I think they were both equally the same. I certainly was not speedy compared to some other people in terms of surgery or seeing patients. And I used to feel guilty about that. And then finally I kind of got to the point where I was like, this is me. This is how I work best. And this is how I feel like I'm doing, you know, the greatest service to my patients. And so I'm going to be okay with that and not feel guilty about it. And it took me a little while to not feel guilty that I wasn't like seeing more people and doing more and more. And I was like, oh, there's a group of patients that appreciate the fact that I'm slower and
Yeah.
um, you know, and take my time. And so I got to
Yeah.
be
What do
okay
you think
with
about
that.
the term closet introvert? Because that's sort of how I've characterized myself.
Well, I don't know. I haven't really come across that term much, but I suppose it's just, especially if you felt that way and you said like you didn't realize you're an introvert till you were an adult,
Hmm.
that it was more of that you had this expectation from society to show up this way and be this way. And so we adapt. We all adapt. And I think obviously physicians are resilient people. They're adaptable, or we would be where, we wouldn't get where we are. And so I think it's just one of those things where at some point you gain that awareness and then you're like, oh, well, maybe I would do it this way,
Yeah.
where maybe the thought hadn't occurred to you before.
Yeah. Do you think that the label in any way um, pigeonholes people and creates a problem?
If you let it. I had this discussion online just recently. People were talking about the different personality tests, and there's pros and cons. And what I have found interesting with a lot of the personality tests, or I shouldn't say a lot, but some of them, the way they define introvert is by absence of extrovert qualities,
Mm.
rather than by the strengths of the qualities that introverts possess. And so yeah. So if you're looking at a personality description like that, like, oh, you're an introvert because you don't have all these great things over here, sure, that could be derogatory. But if you're looking at like, oh, you're an introvert and you have all these wonderful strengths and contributions to be made, then to me that's not pigeonholing. And I think with any label, it helps create awareness, but my feeling is you use the labels if they're self-affirming and they help you
Hmm.
understand yourself and show up in a way that feels more comfortable. And if it doesn't feel good, then don't use it.
Yeah, I definitely find it to be, um, in a sense, a weight lifted when I have conversations. When I realized it for myself, and also when I have these conversations with families, um, and you look at it from a strength-based perspective, that there's not one way that people are supposed to be. You feel it internally of who you are and how you are. And when you look at the positives and the strengths, it's like, oh, I'm going to let my kid be my kid. I'm going to let myself be myself. And sometimes an introvert needs to function in a extrovert world, and we can do it. We're strong, but then we need to relax afterwards.
Exactly. Yeah. I always think, yeah, there's definitely a lot of stereotypes and I think misconceptions. Just like, some people might think that introverts aren't good speakers, and I know a ton of introverts who are excellent speakers. And it's not really, again, it's not about being shy.
Right.
Now, there are shy introverts for sure, and there are definitely introverts that have social anxiety for
Right.
sure. But you get that on the other end as
So
well.
Charity, I noticed you have a deep connection with nature. Tell me about that and how that plays into your life.
Yeah, it's funny because I don't remember as a child necessarily being deeply connected. And then, so I don't know. I even, in undergrad, I started out as biology major and I switched to being a zoology major so I wouldn't have to take any botany classes. And then it turned out that I love plants. And so I was taking them anyway for fun. Like it was just a weird progression, but I definitely now feel a very deep connection to nature. And it's one of the places where I go to relax for sure. And I always say the forest is where I go do my therapy. And I think yeah, there's just something about being in nature. I think it helps you slow down. I think it helps you start being more aware.
Hmm.
Um, and it's most often more quiet.
Yeah, and connect for sure. For sure. So tell me about how you work with, I know you do some coaching with
hmm
introverts in healthcare. Tell me about a typical client or how you help people.
Yeah, so I am doing one-on-one coaching. I think for introverts, we often tend to be more private, and so there's definitely value to group coaching. And I'm starting with those people that are perhaps like, I don't really need everybody to know my business. And my biggest thing is for people who are unhappy in their career, especially in healthcare. There's a lot of factors that can play into that. And so rather than just jumping ship right away, I like to kind of look at things and make things as the best that they can be.
Hmm.
And then decide from there, like, okay, I've made everything as good as it can be. Do I want to stay or do I want to go? As opposed to just feeling like I got to get out, I got to get out, I got to get out of here. And so that's kind of how I like to approach it. And I definitely have a nature inspired, you know, I use a lot of nature metaphors
Yeah.
and, um,
Listen,
you
I
know,
couldn't agree with that model of thinking more. You don't want to run away from something. You want to run to something, and you want to make everything as good as you can, and then decide from a clear, open mind if you're in the right place. And I find that many, many doctors are in the right place. Some aren't, but and you've got to get quiet to hear that inner voice of where you want to be and what you want to do.
exactly. And sometimes it's just little shifts that you wouldn't think would make a big difference that do. It can be the little things can really make a big difference. Not to be cliche, but and there's also using creativity and sometimes asking for what you need because I think a lot of physicians are in the place of always like helping others and we
Right.
forget that we can like, hey, this might support me.
Yeah. And you told me something interesting when we first met, which was that you um never actually wanted to be a doctor in the first place. Is that right?
Well, I wouldn't say it that way. So no,
Okay.
I definitely was very interested in being a physician when I went into medicine. But as I graduated and in my got into the clinical years, I just saw that um that style of helping people wasn't exactly like the thing that I thought it was going to be when I went into medicine, right? And so um I enjoy the getting to know people more deeply and the just kind of in and out, in and out, in and out, wasn't as appealing to me. Um,
Yeah.
and
And
I
I
think
don't
there,
bring that out to put you on the spot in any way. I mean it in an empowering way. Like you have had a very long career as an ophthalmologist and made lots of changes in your career, and yet knew that there was something else calling you. And so you moved into coaching and helping people because you can still help people, which is really what every doctor wants to be doing, right? We
yeah,
go
yeah,
into a helping career.
yeah.
So tell me, Charity, any last thoughts, advice, ways people can contact you?
Yeah, so as far as just thoughts and advice is just, for people listening, especially if you're struggling in your job, is just really paying attention to the energy and, paying attention to what drains you and what really lights you up. Because sometimes you can just shift that ratio just enough and it makes everything better. And sometimes it doesn't, and then you can explore. And that's one of the things that I'm about, is being creative and having curiosity and exploring.
Yeah.
Um,
Now, before you add where people can reach you, I want to expand on that and say that so many of us as doctors, we're so focused in on our thoughts and our heads, we miss all of the information that's coming from our bodies. And it's actually not that easy to necessarily know what's giving you a positive or a negative energy. And it seems so intuitive to you. And I say, really, that can be a challenge. But do you ever get people who really, how are you feeling right now? And they give you a thought instead of like an energy?
Definitely. And I still do that. I mean, that's one of the things that I've really, really appreciated about coaching, is that the more I've been exposed to coaching and different coaching styles and methods. Definitely. I started out here
Mhm.
and then I was able to sink down, and now, you have your body is telling you something, but yeah, you're right. A lot of times we don't listen to it, or we've been trained through our medical training that you don't have time to listen to it.
Right.
Like, you can't go to the bathroom, you can't do this, you can't, like, you
Right.
don't pay attention to it. You're not hungry, you're not tired, you're not this. And so it just requires a little bit of retraining, I think.
Yes. Yes. Okay. That's a great place, I think, for us to stop. And if you could just tell it, people, if you have any introverts out there who would love to meet you, how can they find you?
Yeah, so my website is just www.charityhicks.com, and Hicks is spelled Hix. I always say, why use, more letters to do what one letter can do.
That's great.
So and I am on LinkedIn, and you can also just reach out to me at hello@charityhicks.com as well.
All right. Well, thank you so much for joining me today, Charity.
Thank you, Jennifer. I appreciate your time.
Okay, and a great big thank you to the listeners, as usual, for choosing to spend your precious time with us. I hope to see you again for our next episode of Reinventing the White Coat.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.